Today we're going to have Keandra, who is our medical assistant here at the clinic, place a patient on therapy, and we're going to demonstrate what you will go through as a patient once you start here at the clinic. Okay, she's going to first now have the patient to lay down on his stomach. From there, she's going to be preparing his therapies. What she has in her hand right now are EMS pads. They will be personalized to the patient. So as you see, she is taking the electric muscle stimulation pads and she is placing them on the patient's back. The pads will have a cold sensation to them because it is gel. However, each patient gets their own EMS pads. So now she is getting ready to place hands-free ultrasound on the patient. So she has to wet the napkin. That keeps it sterile and it keeps it from touching your skin, and it also creates a moist barrier between you and the deep heat that is going to penetrate through the body. So as you can see, the ultrasound gel, the sterile napkin, and then she's going to place it on top of the area that is in question. From there, she's now going to place ice on the patient. As you can see, this ice is specifically for the neck area, so she's going to place that size ice pack on the upper part of the body. And then from there, she's going to start the machine, and the patient will be on therapy for approximately 15 minutes. Just so you know, electric muscle stimulation is used to reduce pain and swelling and muscle spasms. The ice that she's using is also used to decrease swelling, and then the ultrasound provides a deep heat to a specific region to reduce pain, joint stiffness, and muscle spasm. And it also increases ligament flexibility. So as she's putting that away, she's going to clean up in her area, make sure everything is nice and straight. She's going to then take the towel off the patient, pull his shirt down. She's going to have him stand up, and he will be moving on to another therapy. It does not matter which therapy you start first. You can start on either side of the therapy bay. You can start with traction or you can start with EMS. So now she's going to have the patient sit down on what we call a traction bed. It's also known as intersegmental traction and mechanical traction. This traction is used with an expectation of relieving pain in or originating from those areas of the spine that are causing discomfort and increasing range of motion in the joint. So as you can see, the patient had to sit down. He is then going to swing around. After he swings around, she's going to place the hot pack underneath his back. From there, the patient is going to lie on his back. She's going to put the pillow up under his head for comfort. And she's also going to place a pillow up under the knees. The pillow up under the knees helps to reduce pressure in the low back. She's going to then start this therapy, which will last approximately 15 to 20 minutes. He is now getting up from therapy, and he's going to swing around and have a seat. Do not get yourself up off of this therapy. Please wait for an attendant to help you get up so that there is no issues. As you can see, the patient has now moved over to our stretch facility. What he's going to do here is he's going to do stretching of the areas in question. It can be the neck, mid-back, or low back area. From there, this helps the patients who have muscle weakness, stiffness, spasticity, and decreased range of motion. This will help to improve your range of motion and also build your endurance. You will see that there are different colors that can be prescribed to a patient. No patient is the same. No patient has the same stretch colors. This activity should not be rushed. You should take your time to make sure you receive full benefit of stretching. This is what we call our iJoy machine. What that does is that helps build his core muscles. He has to use his stomach muscles to tighten up, and he also has to tighten up his low back, shoulders, and neck. That helps with stability, posture, and it also strengthens the core and the low back muscles. Patients may also be asked to do light weights. Weights also help strengthen the muscles that could be causing an issue. That can help build strength in the neck and in the upper body. Before or after the patient has completed their therapies, they will come in what we call an adjustment room. The patient will then get on this table. The table can be lowered so that the patient does not have to lay down and sit up, so it can actually do the work for them. This is the room that the doctor will come in and adjust the patient. The patient will get on safely and off safely with the help of the doctor.